Welcome back to the PRN SLP newsletter. It looks like our thing was stopped recording. I think we're still going. Okay.
I think it's going.
If it stops recording, I'll redo this, so we'll do this twice. But this is the PRN SLP. It's good to be back recording. This week we're going to talk about who should do PRN, or who should consider working PRN as a speech pathologist. Mm-hmm. So this is a fun one. We'll have a lot of things we'll talk about, but we're going to have 3 main points. So what are our 3 main points?
SLPs who want more control over their lives, and we'll kind of get into details of what they want more control over. Benefits, either covered or willing to get benefits. Like I said, we'll go into that. And then just SLPs who need a better life, or who just want a better life. Maybe you don't need it, but you want your life to be better. It's just a really good way to get all of these things going for you and in your favor. So you want to start with the more control part?
Yeah, so just
everything?
make sure we're making it clear, because I don't want you to stating the points clearly. So who should work PRN? Point 1, if you want more control. Mm-hmm. So more control, like when we say more control, like what are we talking about?
Yeah, there's kind of 2 facets where the control comes in. One of them is if you just want to make more money, or you want to be in control of how much money you make. Both of those are kind of under this control thing. We've talked a little bit in the past about how PRN, in whatever capacity you use it, whether that's you have a full-time job and you've got 1 or 2 PRN gigs on the side, or if you're all the way up the spectrum to exclusively PRN, there's just more money involved here. You could have your nice full-time, you like your full-time, you don't have a problem with it, but let's say you want some Christmas money, or you need to, there's a repair in your house you need to cover. We have the option as speech pathologists to have the same type of job at another place where you get paid more per hour. So if you want to be able to control whether or not you can make more money, PRN, even just in a small capacity, is really good for that. The other side of that too is if you're exclusively PRN, you can rev up or rev down your income. Like you can turn on the gas. If you, let's say that you have a big trip coming up and you want extra spending money for it, that's when you rev up your hours, and you have that option. You won't get in trouble for going into overtime. Like if you have the mental space and energy and capacity to work a bunch of hours and rake it in, you have that option as a PRN.
Make it rain.
You can make it rain. You get more per hour. We've said that a lot because it's actually really important. But you can really go to the bank on this. You can fill your bank account with a lot of money if you are willing to put in a lot of hours, if that's what you're looking for. There's some people who they just kind of want like a full-time salary for less work, and we'll talk about that later. But that's that control. You are determining what is best for you in terms of your income, and then you can control how much or how little you make, however you want to do that. And we're joined by Lolly today. Oh, hello. Yeah. So that's the big pie. That's the side of the financial control that you gain. And SLPs who want more control over their money should consider PRN in some capacity.
To make it clear too, it's almost like what PRN gives you is control over 2 different knobs, 2 different dials, right? So the first one being over money. So if I want to turn up that dial or turn down that dial, I can. And the second one would be time.
Yes.
So why don't you dive into the time part?
Because there's money and then time. So we've talked about money. Let's go into time now. As PRN, you have the right to say yes to work and say no to work, and there's no repercussions for it. Therefore, that means if you need more time to do other things, to go on a trip, to take care of your kids, to take care of your aging parents, whatever that is, you can just take it. You can just have that time, and you can control when you go into a certain job that you have. You can say, yes, I can work those hours, or no, sorry, I can't be there. And that's all you have to say. That amount of control that you have over that, just the ability when you're working, is huge. And if you're looking for a way to be more in control of your time, and in whatever capacity you want to use your time, like if you want to be complete in control of that, working PRN is a really, really good way to do that. in my opinion, it's the best way to do that. Because you can just, like we talked about, you can rev up your hours. Like that's the same with time. If you don't have a lot going on and you want to just rev up your hours and you make extra money, like we touched on earlier, you can use your time to go make more money if you want. You can use your time that way. Or if you don't want to use your time that way, you don't have to. So with a full-time job, you don't have that option. You do not have the control over your time. You don't even have control over your PTO, which we've talked about a little bit too, or a lot too.
Not totally.
Not total control over your PTO. So just having that control. If you're really stuck and you're just frustrated that you feel out of control of your life in general, PRN's great. It will put you back in control over what you do when you do it, and over your income. So
we're saying, who should consider working PRN, right? Point number one is gives you more control. Mm-hmm. But I think another way of saying it too is that it's almost like it gives you more choice.
Yeah.
Right?
Yeah.
It's not like you get away from the reality that you have to work, because we have to work, we have to make money.
Right.
We have to pay our bills, all that stuff. So you have to work somewhere. You
right.
can't get away from not working, but at least it allows you to control it on your terms.
Yes. Yes.
And maybe another way of saying it too is like it just gives you ultimate flexibility. Mm-hmm. If life happens, if you got to address things, move things, that like it gives you the ability to work in a way that fits to your life. Instead of you having to fit to your work, mm-hmm. work can fit to you.
Yes, work can fit to your life, and you can determine what your life looks like. And I know that a lot of full-time employees, whether they're therapists or not, don't feel as if they have the control over their lives that they would want in order to be happier.
Right.
So that's a huge thing. If control is something you want,
I would be curious.
Yeah.
There's no way we can quantify it now. Maybe later on. But if we had a good group of people we could poll, I would mm-hmm. wonder like if what the polling would show. If we could tell an employee, hey, what if you had total control of when and how you worked? How much stress that would alleviate?
I feel like it'd be a very interesting survey. Like I think a lot of people would.
I think it might be as high as 80% of stress for most people would
mm-hmm.
change
Mm-hmm. Mm-hmm.
if they could know they could just change how or when they work.
Yes. Especially in healthcare, I think, and even private practice. If you work with kiddos, burnout's real there too. We'll get to that in a second, but not having control over your life is real there as well. It doesn't go away just because you work in a school or just because you work in a private practice. Even adult private practices like that. Yeah. It is present no matter where you go. That lack of control over your life. So if you can find a way to use being PRN as a tool to help you gain control and choice over how you spend your time, and also how you make your money and how much money you make, just think about how much that would improve your quality of life.
Right.
And for me, just my personal experience, it is a night and day difference. Yep. Completely night and day. Can I give an example of my full-time job that I had?
Don't say what.
No, it was just a private practice. Yeah, my very first job.
Oh, sure.
My CFY was in a private practice pediatric clinic. It was a great clinic. It's not like anything was wrong with that place or anything. But just having to be beholden to this clinic for my sick days, when I took off, when I didn't take off, I had to have doctor's notes for every time I got sick. I mean, and just working with kiddos, I got sick a lot because kiddos just carry germs. It was very stressful for me. Some people that doesn't bother, they just kind of accept it and it doesn't raise their stress levels. But I was constantly stressed my CFY year, not because of my supervisor or anything like that, but literally because I had no control over my life because I was employed full-time and expected.
A decade plus back.
This is 10 years ago. But I mean, I still
More
think.
than 10 years ago.
But I still think that the same thing rings true today. And that's one of the biggest reasons that whenever I ended my CFY and moved back here and was looking for employment, I really was hesitant to take a full-time position. I didn't want to be full-time anywhere. I wanted choice. And I didn't realize that it was going to evolve into what I have today. Like that was not, like it wasn't planned. It just happened organically. But I just remember thinking, I want to work, I want to make money, but I want to be in control of it.
Yeah.
That was actually where everything sprouted from.
Everything came out of that.
Yeah. So just kind of think about that. Think about where are you feeling you're lacking control in your life? And is there a way that some level of PRN can give you back some of that control, or maybe even all of that control?
Good.
Yeah.
So that's point one.
Yeah.
Point one, as we said before, is if you want more control, right? Mm-hmm. 2 different knobs you can turn. Point two of who should consider working PRN are
benefits. Yes. So
what about benefits?
There's 2 kind of facets to this as well.
Okay.
So if you're married, you have a spouse or a partner who has maybe a full-time job or has insurance coverage, healthcare coverage through their employer or whatever they do.
So you wouldn't need it.
You wouldn't need to have health insurance through your employer.
Right.
You can be on theirs. That's a simple fix. That's honestly, it's the simplest solution to that question. Other facet of this is, let's say you're single, or maybe you're married, but you're not in a position where you can get on your spouse's or partner's health insurance policy. For whatever reason, that's not an option. You can get your own benefits covered through healthcare.gov. And because you make more per hour as PRN exclusively, you can save some of that money back to pay for your own coverage through that. Am I saying that well enough?
Which
right. Just about saving some of your income.
I think you are. Let me like summarize a little bit more too. So basically, someone who'd be ideal to work the PRN life would be someone who already has one of the biggest hard to get things, health insurance, through a spouse. And the reason is because you need coverage. The number one reason for for debt in the United States is actually medical debt. I think the number reason for bankruptcy, I should say, is medical related debt, which means they didn't have health insurance to cover the major bills.
Right.
So that's something you don't want to go without, right? But if you have a spouse, if you're married, and that partner has and carries health insurance, that actually makes the decision to go PRN even easier.
Right.
And it's not even just that they have health insurance, it's that you also have that income as well. So you've got partial income for the household, and they've got benefits for you. That it's almost like why would you not do PRN at that point?
Right.
Because you have the freedom to go out there and try something. And for a lot of people who are watching this, the majority of speech pathologists are female, and maybe I don't want to assume, but maybe a lot of them are risk averse. And so the idea of being on your own or doing PRN only sounds kind of risky. But the reality is, if you have a spouse who has their income coming in and health insurance, you've got an incredible floor. Why not hop out and try it, right? Especially if you've got a couple months worth of income saved where you can afford to do this. It's almost like there's very little to lose, right? Because we've mentioned this in previous videos before. What do you have to lose? What you're already doing.
Yeah.
Like you're living the worst case scenario, which is you're working at a job full time that you may not love.
Right.
So if you go out and try PRN, doesn't work out, and you come back to another full time job, what did you lose? Nothing. But the reality is the demand is so great. If you do go out there and try to find that, you're probably going to find work real quick, depending on where you live and everything. But in most major metro areas, there's, tell me if I'm wrong here, you're going to be just fine.
Yes. And sometimes in rural areas have trouble finding coverage.
Oh, that's a good point. Like rural hospitals?
Rural hospitals, they have trouble getting people, just the pool of people is harder to find qualified therapists for. So, there was one time where I did kind of a coverage thing in like a smaller town for a little bit, and it was actually not bad. I didn't mind driving a little bit, but I made some really good money from that, and I got some consistency from that because they had no one else. Right.
The demand was so great that one person could just do all that.
But the other thing, what you were saying about that the income and having a spouse with income, I will tell you, as someone who if you want to you feel as if you're still contributing to your family, and there are some SLPs that I know who are full-time PRN who make just as much, if not more, than their spouse who has their full-time job, like in another field sometimes.
That's true.
Because they're making more per hour and they're filling in a full 40-hour week with PRN pay. That's huge.
Well, I think the true comparison, like you're right, what you're saying. There are a lot of speech paths who are making incredible money working just PRN.
Yes.
But I think the true comparison is those same speech paths, how much are they making from their old job in less hours?
Correct.
That's
huge.
That's the truth. Because basically, if they can make what they were making before with less hours because the rate is higher,
right?
I mean, again, why would you not?
Yeah,
why would you turn that down?
Exactly. Well, and but my point with that was, don't feel as if you want to try PRN that you're going to be detracting from your family. Like
wait, why would they be detracting from your family?
Well, just in the sense of like, you have to rely on your spouses for their health insurance so you can kind of have more freedom. But you in reality can be making just as much, if not more, than your spouse sometimes, depending on how you structure it. So don't feel as if you're like going to be a burden or a drag by trying this out. You can this can actually be pretty financially successful for you if you structure it correctly.
Are you saying some speech paths might think they won't be contributing if they don't have a guaranteed income?
Correct. Yes.
And they're freaked out for that reason, and they feel guilty or okay.
Because I've had conversations with other friends, SLP friends, who they want to go full-time PRN, but they have this guilt and they have this like, oh no, like, but my income's not going to be guaranteed anymore.
Right.
What if I'm not going to be pulling in money for the family like I need to be?
Right.
I don't want my husband or my spouse or my wife, to think that like I'm not wanting to help contribute, that I just want to like, have all this free time. That's not it. But they're afraid to try it because of that. And I want to reassure you that you can most definitely bring in good money to your household. My point is, don't be afraid to try it. And if you know how to structure it correctly, and if you know how to work it, you can do that. And it is possible. So don't let that get in your way, that fear get in your way of, if you really want to try this, try it.
So just go back to the main point, the second point here. So who should consider PRN?
Benefits,
If you got a spouse who has an income and has health benefits covered, it's like you should absolutely be considering this. Like when we say considering this, but considering potentially going full-time PRN. Because there's way more upsides than to the perceived downsides.
Correct.
So that's what we're trying to get across.
Yeah. But I'm glad thank you for helping me clarify that, because that I do know that is a fear with some of the friends that I've talked to. They're just like, oh no, what if I'm like, they think I just want to like take all this time off, and reality, I really do want to work. I just want to be in control of how I work. I'm like, that's fine. You can be in control of how much you work, and you can make good money, and you can contribute to your family, and you're not detracting from that.
Right.
If you know how to work it. So don't be afraid. Don't let that get in your way of trying it if this is something you really want to do.
And because I know this question is probably going to come up too. So we talked about like speech paths who are married or a partner, they have income, they have benefits. What about all the single ladies? Like all the
single
ladies
boys trying this out. Yes.
There's about like 4 single boys watching this.
No,
let's be real.
There's more than that, I think.
Okay, there's 5.
But if you're single, or maybe married but you don't have the option of being on their health insurance, I mean, because that exists. I've had several friends like that.
This could be legitimate fear. People are like, oh no, like I don't have someone to fall back on or whatever. So let me say this: if you have several months worth of expenses saved up, right, and you have the tenacity to go onto healthcare.gov, get your own healthcare coverage, health insurance policy, and hustle to get these jobs lined up and do things. This can be one of the greatest things. Like if you were in your 20s and you were just starting out, right? It sounds like it's scary in the front end, but maybe someone's still like maybe they just graduated, maybe they're still at home. That like you have so much opportunity that if you start working out this way and you build those relationships and you build those cycles where you can have consistent income in different places, this could be one of the most like awesome jobs ever.
It can.
Because if you need to go to like New York City to see a friend on a weekend, or someone's getting married and you know, you can just take the time off.
Right.
And as long as you need to save, because it's on you, so you need to save enough money for other periods of time are maybe a little lower, or if you have like life happen, like you need to take time off, right? If you're not working, you're not getting paid. So you've got to have that buffer built up. But if you can build that up, this is actually better than if you started a legit business on your own. Like if I was like financial planner, if I was looking at in terms of like risk of things, right? Lowest risk would be like full-time job since they can pay you. But as we're discovering and talking about with the PRN things, they're still treating you like you're not in full time. They can deny your things. So really, you're not even getting that.
Right.
Next would be like what we're talking about, where you can essentially work in between self-employed and like a full-time gig.
Mm-hmm.
So essentially you can have someone who starts a whole business where they could go bust or broke, right? You guys literally are in between. You don't have to have a separate entity you make.
Mm-hmm.
You just go work for these hospitals or other entities. And it's like you're able to have the best of both worlds. You have the best of being self-employed and the best of being like under an entity.
Correct.
That's just crazy.
Yeah. But going back to like if you're single and scared to try this, don't let the lack of health insurance coverage from an employer stop you.
Right.
You can get it on your own.
Right.
You can.
And you should.
And you should get it on.
You
absolutely
need to get it on your own.
Right. But that's the thing is like most people I talk to, they're like, I know I need health insurance, but I'm afraid to try PRN. What do I do?
Right.
And the answer is you get it through healthcare.gov, and also you're paid more per hour when you're PRN. You can save some because they're not covering your health insurance. So you get that money to you when you work. So you can save some of that extra money that you make per hour to help you cover your health insurance expenses through them.
And when you're working PRN, that is now a deductible expense.
Oh, health insurance?
Mm-hmm.
I didn't know that. Okay.
Because you're paying for it.
Yeah. So tax deduction is what
and
you're talking about, right?
And there's a lot of caveats to that too, but generally speaking, that can be a deduction.
Mm-hmm.
So so that's another thing. It's actually, you don't know this, but it's a deduction when you work for a company, that the money you're paying for your own health insurance, because you don't actually pay for all of it, you pay for a portion.
Right.
The hospital, the business pays for a portion, you pay for the other half of it. Your portion you're paying off actually lowers your taxable income. So same thing here. The portion you're paying on your own for that will lower your taxable income.
Right.
So
exactly. So
there's just winning all around.
Yeah, it is. So like we said, don't let those factors stop you from, if you want to do this, don't let these factors stop you.
Right. There
are ways to do this, whether you're partnered, married, or you're single, or maybe you're partnered but not able to get on their insurance. It is still possible for you to do this if this is something that you really want to do.
Right.
So
who should work PRN? So we said the first point, anyone who has more control. Second point, if you can get benefits covered, right? Maybe second income.
You go about doing that.
Third point.
Yes. If you need a better life, or just want a better life, you don't have to need it. You can just want a better life. There's a lot of caveats to this. We're going to touch on 4 of these. But number 1, I would say that when I talk to another full-time SLP or a full-time SLP, they're burned out. And that is highly impacting their quality of life in a negative way.
A lot of burnout.
Tons of burnout. And burnout, it's a huge thing in healthcare right now. And I would say in a lot of other jobs too, but healthcare is really big because there's, like, we talked about in the previous episode, boomers are retiring. There's a lot of patients to see, not enough of us to see all of the patients. So it's very easy to get overworked, overbooked, and over everything. And when you work PRN, as we've said earlier, you are in control of when you work, how long you work, and even how many patients you see in one day. I've found for me that burnout is much less prevalent in my life because I have that control. And because I have less burnout, my quality of life is better.
Right.
My stress levels are so much less than they were when I had a full-time job.
What you want, if you can't see it, but you want to be as unstressed as Lolly.
Completely unstressed.
Completely unstressed.
No
She's
stress.
Totally just relaxed.
Right. So you can avoid and lessen burnout by working this way. I'm not going to promise that you're never going to get burned out by working this way because it still happens, especially as you're still figuring out, how much is too much for you. You're going to mess up here and there.
We need to make a caveat on that too. We need to make a distinction between building the new neural pathways to work a little differently,
right,
versus routine, systematic stress that's a part of your job.
Yeah.
It's one thing, if it took you a little bit to get used to working this way, and then you get used to it and you're fine. That's not the same thing as working at a job where it routinely overstresses you.
Right.
Those are two different things.
Right. Right. Exactly.
Right.
So let me give an example too. There's one, I've had several, but sometimes my companies, the ones I work for, PRN, sometimes they take turns burning me out, you know, just depending on the circumstances. And when I notice that happening, and now I have to really pay attention to myself and be self-aware to know when I'm approaching that burnout feeling. If I'm noticing it's with this company or with this location that I'm working at, I do what I can, and I can do a lot because I'm in control. I rev down. I throttle back at that place. Maybe the next week, 2 weeks, if I schedule with them at all, I'll schedule a little bit. You know, I'll back off, and I'll supplement maybe somewhere else where they're not burning me out. Maybe it's more pleasant to work there. Maybe they're nicer to me there. And, you know, and I can handle that. But a huge part of this is you have to be self-aware to know when you're about to hit bottom, and do what you can to pull up the plane, to get out of the nosedive. And you can do that when you're PRN. When you're full-time, you're locked in. You have to go every day from this time to this time. You have to get all these things done, patient seen, whatever. When you're PRN, you don't have that obligation in that sense. Like, you're still obligated to go and do your job when you say, and you have to keep your word. But, you know, if I don't want to go back to that place the next day, I don't have to. I can schedule another place, or I can take the day off if I feel like I've got enough hours or enough money saved up. So just knowing that is enough sometimes to keep the burnout at bay. Even sometimes, like, I get really busy and like I'm like, oh, you know, I could just rev back. But sometimes I don't, because it's like I'm just going to push through. But just knowing I have the option, like, in my brain, actually will keep me from burning out even when I'm very busy at work. And I'm choosing to keep staying busy because maybe I want some more hours, or maybe we're trying to save up for something. That's a really big thing. The other thing about better quality of life that feeds into this is the control of your PTO and sick leave. You don't need to be playing these games with this PTO stuff. It's all a game to these companies. It really is. We've talked about this before. I'll just touch on it briefly. There's a lot of times these corporations, when they have a low caseload at whatever facility they own, they'll force you to take your PTO so that they don't have to pay you. They don't have to pay you for. And
we've said this before, but reiterate again. If you're only seeing this video, not the other ones we've said before, but these companies are making a profit.
Yes.
And they're making a profit the whole year. And just because their caseload is low to 1 month does not mean they don't have the cash to pay you. It's meaning they don't want to pay you when it's low, so their profit margin stays a certain way.
Right.
So it's not what it seems.
Right. They're choosing to not pay you. They're choosing that. I mean, the other thing too is the sick leave. You know, if you're sick, how many full-time people do I talk to all the time whose managers, okay, when you coming back, you need to do this from home. You need to make these phone calls even though you're sick, even though you're home.
It's inhumane.
It's inhumane. It really is.
Yeah.
And honestly, they don't want us working around vulnerable people when they're sick, when we're sick. You know, it's like just the ethics of that is also highly questionable.
But also, like, just like, you're helping people who are sick,
right?
But you can't be sick,
right?
It's
Exactly.
Like, that doesn't make any sense.
And so, if you are an SLP who wants better quality of life and not have to stress about the PTO situation, saving it up, not being able to control when you use it,
right?
Because there's times when I've had friends who submitted for PTO around the holidays, whatever. They'll say no. These companies will say no because we have too many people for you to see, and they would rather keep a full-time in rather than bringing somebody else in,
right?
Because they don't want to pay. They don't want to pay more. It's cheaper for them. They're not on your side on this.
They're trying to save money.
They are. They're
not trying to help you.
No.
They're trying to, like. And it's wrong that they can basically not pay you.
Correct.
Like, there's no other line of business where this would happen. Like, if you went to any other major corporation and said, okay, when on the 1 month of the year it's a little lower than the rest of the months, we're going to cut everybody's paycheck.
Right.
Like, they would revolt. They would leave. They wouldn't work there. But in healthcare, you guys are getting the wrong end of the shaft. And we've kind of touched on this already, so we'll move on.
We'll move on. But
that's the point.
But that I've found for me and for my other friends that work exclusively PRN, just not having the stress of worrying about that is a huge improvement in quality of life, a better life in general. Last thing that contributes to a better quality of life, of who should consider, if you're looking for better quality of life, this factor of variety is actually a pretty big deal. There's a lot of people out there, and I'm included, who kind of get bored doing the same thing over and over again. Now, there's people who aren't that way.
Right.
Totally fine. No, there's nothing wrong with that. But I kind of get a little antsy or a little bored when I know that I'm having to be in the same spot every single day, all day long, without any variety. For me, the remedy for that is I work in multiple settings. I work for multiple companies. Sometimes I go 2 to 3 places in one day. That variety for me, and for my friends that have done this and who love doing this, it's wonderful. It's stimulating. It's challenging. I feel productive. I feel like I'm making a difference. And because I don't feel bored, I do better work. Because I don't feel like I'm in a rut. I'm not stuck. You know, I have this, I finish my work at one place and then I'm on to the next place and I do my work there and then I'm on to the next. And for me, and my friends who do this, my quality of life is so much better because I'm working within how I like to operate. And there's a lot of full-time stuck out there who are getting burned out and getting bored. Not Lolly. Lolly's not burned out or bored. She's very, very comfortable. But, you know, if you feel variety would benefit your quality of life in your work, PRN is the way to do it. You can vary it up according to how you want it to.
If you need to spend more time at home with your doggos.
Yes. That's true too. You can, and that's the thing. You can vary how you spend your time, even when you're not working. You know, it doesn't just apply to work. It applies to just all of your time in general. So just keep in mind, if you like the idea of having your finger in multiple different settings and keeping your skills sharp in all of those settings, and that would feel good to you, and that would feel like you're being satisfied in your work, that's gonna, if those things are true for you, that's gonna improve your quality of life. So consider that if you're thinking through this and thinking about what you're good at and what you feel most comfortable doing, what you feel the happiest doing, and think about how maybe doing PRN would contribute to that.
Right.
Is there anything else you want to add about that?
No. So I mean, just overall summary. So who should consider PRN? One, you want more control. You want those two knobs of maybe more money, more time, or some variation of the two. Just all that. Two, benefits. You can get it covered through a spouse. You're willing to do it yourself. Three, you need better quality of life. And if you have any one of those three or all of those three, I mean, you should definitely consider working PRN fully even, like PRN only, because it might give you a whole lot. And if you're somewhere on the spectrum and you still need something else, even if you're taking like certain parts of that and working PRN part-time,
right,
that's still a huge win. Huge win. Like there's not a downside to having something that gives you a little more flexibility, whatever you need. Yeah,
I have several full-times who have like 1 or 2 PRN gigs, and they feel so happy because they say, you know, I get a little variety. It's not more variety than I can handle, you know, but I still have the stability and the feeling that like of groundedness of staying in one place, because for them that's their quality of life. That's what they're looking for.
Right.
So this is the thing. PRN in any capacity can contribute to just a better life in general.
PRN allows you to tailor your work to you, not have to arrange your life to work.
Exactly. Even when you're full-time somewhere. So, yeah. Yeah, I think that was really good.
So
yes,
and
Lolly was very snuggly.
Really good. So again, if you're not subscribed to our newsletter on Substack, please go to the PRN SLP on Substack. Follow us so you can get all these updates and things, and so you can see more Lolly pictures. And Ivy, she's sleeping over here in her little cat condo. But we appreciate it. Thanks for joining us.
Yes. Bye, guys.
Bye.
See you next time.